Good afternoon. This is Thursday, May 28th, 2020. How would you rate 2020 so far? I saw a meme of a gopher going, ah! Ah! I think that's kind of been the consensus on what 2020 has been like so far. Today, we're going to cover a lot of information. We're going to go through a very action-packed next 30 minutes. And I'm going to be sharing the screen with all of you in regards to a presentation that we've prepared today for everyone. So we're going to get started with that right away. And as always, if you want to catch up on any of the updates that we've done over the past 8 or 9 weeks, you can go to our website, www.dispinetwealthmanagement.com. You can also go to wealthwithclarity.com or heck, just chaddispinett.com. We'll get you to our website. You go under the resources tab and you'll be able to access all the webinars that we've done throughout the COVID shutdown and everything that's going on with that. So today we're going to be talking about coping with the COVID-19 information at dispinetwealthmanagement.com if you have questions or you want to comment on the presentation or what we've gone through today. So with that, let's get started. We got a full slate ahead. This is the level-headed weekly update. Keeping your head while others around you are losing theirs. So level-headed is thinking through in a clear and sound manner. Cool heads, calm thinking. So these are some of my favorite masks that were out there. Norton's antivirus. This lady has it figured out. Some of my favorite slides from over the past few weeks. CDC to prevent coronavirus. Stay home, avoid physical contact, and do not go into large crowds. This guy says, I've been training for this moment my entire life. Oh, beautiful. When you work from home and somebody wants to video chat. This is for my wife. She loves cat videos. Zoom meeting audio only. Zoom meeting with video. How beautiful is that? Hey, Jake from State Farm, what are you wearing? Hazmat suit. The original Zoom meeting. Hollywood Squares. Anybody remember that? So we've been doing a lot of Zoom meetings here over the past few weeks, and it sometimes feels a little bit like this. Alice, turn on your video. No. It's the button on the bottom. Not that one. Over to your left. Jan, you're on mute. Unmute your. Jan, can you hear me? Unmute yourself. How to properly greet someone during the coronavirus outbreak. So handshakes are out. The Vulcan greeting is in. I love this. So when your boss asks you for proof that you're in the hospital, I love this guy's proof. In case you're not paying close attention, that is his Apple iPhone earbuds with the charger cord strapped to his hand. That is awesome. So homeschooling imagined, homeschooling reality. Oh, that's beautiful. Okay, so there's a lot of good news. In case you hadn't heard it, Chuck Norris has been exposed to the coronavirus and the virus is now in quarantine for the next 14 days. How sweet is that? Now, if you don't think that's funny, there's something wrong with you. Chuck Norris is a bad mama jama. Come on, people. Summer boosts people's spirits, and there is some evidence that high temperatures and high humidity reduce the transmission of the virus. That is good news. I don't know if you saw this. CDC changed their stance. The COVID-19 does not spread easily on contaminated surfaces. Latest report. Although the world is full of suffering, it is also full of overcoming it. That's a quote by Helen Keller. When we first started reporting in direct opposition of the media, by the way, who is reporting the death toll, the new death toll, all about death, we started recording how many people had recovered from the coronavirus. On April 13th, it was 435,000 people. As of today, over 2.5 million people worldwide and over 500,000 people in the United States alone. So if you think about the outbreaks following the bell curve, the newest US case stay flattened. We're seeing that the cases are starting to flatten and actually go down. So that's good news if you're looking at a bell curve. US virus recoveries grow. I believe we must put every tragedy into perspective or we will panic. So keeping in mind that the loss of life, the coronavirus, the people who have lost their life to that, it indeed is a tragedy. But if we don't keep perspective, we will have panic. So in a crisis, facts are our allies and facts are our friends. I am a fact-based person. So 3 perspective questions that we need to use to keep things in perspective. How's the US doing with the COVID-19 versus other countries? Is it getting better or worse? And how does COVID-19 compare with other diseases? We've asked this question several times. Well, if we look at the population in millions, one of the things that we keep hearing is, oh, we've got the most deaths. We have one of the largest populations, 327 million, versus Germany, France, UK, Italy, Spain, Canada, Sweden. So we have a lot more people. Now, with that in mind, what is the mortality rate per 100,000 in the US versus other countries? 31 versus, say, almost 60 in the UK, 54 in Italy. Now, I believe these numbers are skewed even and that it is way less than this. Sweden says the controversial virus strategy is proving effective. That was in an article by Bloomberg. So what did Sweden do? They said, as opposed to Germany and Britain and the United States and all these countries that have put measures in place to shut down parts of their economy or social distancing, Sweden said, you know what? Be smart. We're not shutting down any businesses. And how has that worked out for them? So you'll notice that the mortality rate in the US is 31. In Sweden, it is 40. So coronavirus lockdown, they've treated it as not quite as big a deal. Yet they've had very similar results to the United States. And we completely shut down our economy for the past 2 months and pumped $5 trillion into the economy while robbing it of $2 trillion. One of the things I'm looking at, daily virus mortality is dropping. Our numbers are dropping. And as a percentage to the world, we're at 5.8 versus the world being at 6.9. Now, not all states and cities are equally impacted by the coronavirus. 57% of US deaths are in 4 states, New York, New Jersey, Massachusetts, and Michigan. New York City being the hardest hit with the COVID-19. Out of the entire state of New York, 72% are in New York City. That's looking at the deaths. Next thing that we look at is what's going on with new cases in New York. Well, we can see by the chart that those are drastically falling as well. One thing I look at is 1 out of every 4 deaths in New York was in New York City, or 1 out of every 4 deaths in the US has been in New York. 70% of those in New York City. So here's something also that's very interesting. Facts, confirmed COVID-19 death rates are not actually being reported correctly. COVID-19 reported death rates include people who never tested positive for COVID-19. The CDC is counting both confirmed and probable deaths. What does that mean? New York City death toll soars past 10,000 in revised virus count. City has more than 3,700 additional people who are presumed to have died, but had never been tested. 1 out of 3 have not been tested. Another article, when the Times did the math, it said new figures increased the total death tally in the United States by 17% in a day when they started using the probables. Well, what's kind of interesting is the symptoms for the flu and lower respiratory disease, which are responsible for about 250,000 deaths a year, have the exact same symptoms as COVID-19. So they're saying, well, if you had those symptoms, it was probably COVID-19. Good news, a recent study in New York shows that millions have been infected with the COVID-19 with no, with the antibody with no symptoms. So they tested, it was about 13.9% of the people in New York's first antibody study tested positive, meaning that they had the virus and recovered. That means up to 2.7 million people could have been infected in New York, which reduces that mortality rate from 7% down to 0.5. That's 0.5%. Governor Cuomo said New York coronavirus projections all wrong. Too early to tell if reopening is working. Another article, Governor Andrew Cuomo out of coronavirus speculation business. But we were all wrong. We all failed. Now, I remember when I was a high school athletic director and we had a kid that slid through, and one of the secretaries that worked for me, she did not put these grades on my desk. However, one of the kids was not eligible, but was competing. Therefore, the entire team had to forfeit 3 of their meets early on in the year. I did not go, when I went in front of the superintendent, I didn't say, oh, my secretary didn't show me. What I said was, I screwed up and we're gonna fix it. The buck stops here. I just had to add this slide. For Cuomo, it's the buck stops over there. Yeah, it's somebody else's fault. Isn't that the way it is with all politicians, though? 9 out of 10 people who have died had underlying health conditions, coronavirus, diabetes, obesity, some of these hypertension. So 9 out of 10 people that passed had underlying health conditions, 50% hypertension, obesity, chronic lung disease, diabetes. It's important to know these. So if you have 1 or more of these conditions, you need to continue to be cautious. Keep your immune system strong, good diet, exercise, sleep, have some fun. We have battled viruses before. So how do we compare to other countries? We've gone through that. What are some of the other viruses? This was compared early on to the Spanish flu back in 1918. If you recall, and I know you do, you remember back in 1919, they canceled the Stanley Cup. So yes, we've done that before. SARS. This was the outbreak. The markets fell, then they recovered. Time magazine, the bird flu is Asia hatching the next human pandemic. Lock up all the chickens, for the love of God. Then it was the swine flu, bird flu, swine flu, MERS, Ebola. I love this. If you can see in the top right here, the WHO, the World Health Organization, Ebola outbreak could last forever. These are great headlines, aren't they? Miami Herald in regards to the Zika outbreak, flu pandemic. So this is relating, they said, you know, this is just like the Spanish flu. If you could read the headline here, it killed more than 20 million people back in 1910? This is nothing like that. So we need perspective over panic. When I think about it, think in terms of a black bucket. I call it the red bucket or the black bucket. The black bucket is things that we have no control over whatsoever. So when you are focusing on the things that you do not have control over, it's like a black hole. If you think about a black hole, what does a black hole do? It draws in all of the light. It becomes this hole of despair. And when we're focusing on the things that we have no control over, we are entering ourselves into a place of despair. We need to focus on the things that we can control. So control the controllables. Don't focus on the things you don't have control over. If you're focusing on the things that you don't have control over, it's going to lead to negative thoughts, bad time. Focus on the things you can control. One of the things you cannot control is the media. Watching the daily death toll, which is out of our control, leaves people feeling powerless, helpless. And when you feel powerless and helpless and you get depressed, it lowers your immune system and your resistance to things. So one of the best ways to fight the coronavirus, keep your spirits high, focus on the things you can control, and turn off the media. Turn off the daily death count. You have to stop and think, what is the media's #1 goal? It is ratings, folks. What do they need for ratings? They need your eyeballs. They need you watching. How do they get it? How do they get it? They get it by using urgency and sensationalism, and it's breaking news. Tune in, tune in, tune in. They're trying to elicit emotions, and we're prone to act and to tune in when emotions of greed and fear are triggered. Right now, it's all about fear, fear, fear. Markets in turmoil. Tune in. Coronavirus, stocks tumble, corona outbreak. Ah! We cannot focus on the things that we can't control. When emotions take over, this is what you end up with. This on the right-hand side, that used to be the toilet paper aisle. There's no toilet paper there. Lines, huge lines, people dressing in masks. Heck, even dressing up Sparky in boots and a mask. I mean, come on, people. Let's focus on the things we can control. And think about this. Once COVID-19 is no longer the top story, what message do you think is going to be told about the stock market, about the economy, about the recovery? You have to ask yourself a couple things. Why did people tune in? It's to be informed, right? Well, what does it inform you of? The news media is informing you of short-term stuff. It's predictions, it's quotes, it's things along those lines. It's today. And guess what? A month from now, you're not going to remember what they said today because it's all going to be about the new headline, the new sensationalism. What is the time frame that we look at when it comes to money, investing, the economy, the markets? Is it a day? Is it a week? Is it a month? Is it 6 months? Is it a year? You need to be thinking longer term than that. Is it a good idea to watch the markets day after day? Oh, the markets are up. Now they're down. The market's up. Then now it's down. I did this presentation before. I've done this in groups. But volatility is really subjective. You got Jimbo and Helga. They both buy a stock for $20. 1 year later, they both sell it for $22. Jimbo checks it every day. This is his experience over the course of the year. Helga didn't check it at all until she sold it. This is her experience. Now, they both bought it at the same price and sold it at the same price. Who had a better experience in the market? So you have to think a little bit longer term. Market movement is not smooth. Headlines should not be driving your decisions on your retirement planning. So here's another one. It's a matter of time. So which portfolio would you rather have? Portfolio A or portfolio B? Now, everybody is going to say portfolio B because you can see there is a clear upward trend from left to right. But here's the kicker. Portfolio A is a section of portfolio B. You have to understand volatility. It's just looking at it in different time frames from October of 09 to June of 10 versus June of 09 to June of 2013. So understanding volatility is super important. Market volatility is not your volatility. It's a function of how often you look, but good financial plans account for volatility. So have you ever heard you plan for the worst, you hope for the best? Well, think in terms, I have a lot of people that are asking me about timing the market. It's not about timing the market, it's about time in the market. They did a study from 1963 to 2004, a 42-year study, and it showed that 15,330 days in that time. That if you were in the market for those 42 years, you had an 11% average annual return. However, if they just took out the top 90 days of trading, top 90 days, 90 out of 15,000, your return would have been 3%. So that's an incredible fact because over the course of 42 years, less than 1% of the trading days represented 96% of the total return in the market. That's a surprising fact. 42-year span, 0.85% of days, 96% of the return in the market. So when you think in terms of how long is your plan, you have to stay focused on a long-term plan. Is your retirement 6 months long? Is it a week long? How long is your money going to have to last? Why do we even sort by days, months, or even a year? I don't know anybody who's planning for a 1-year retirement. So how long are you going to need your money in retirement? 5 years? Here's a chart of the last 5 years. 10 years? Here's a chart of the last 10 years. So here's the big question. How might the financial media be a detriment to an investor? Hopefully you realize that the media is made for traders and speculators, not for investors. And that if you heed the advice of the media, you are not actually going to be a long-term investor anymore. You've now crossed the line from investing into speculating or short-term outcomes and moves. Here, we call that gambling. So I don't believe that you should be gambling with your retirement. You need to stay focused on a long-term plan. Now let's talk a little bit about the protective measures that we took here in the U.S. We took protective measures to hold down the number of new cases. Now, when you do that, what is a side effect of that? A side effect becomes a recession which lasts longer than it would have if you wouldn't have done anything at all. So think about the numbers. 38.6 million people have filed for unemployment since March. We're looking at unemployment rates of like a quarter that we haven't seen since the Great Depression. Now, clearly, the consequences of a prolonged shutdown of our country and our economy are going to have a negative effect on the economy at some point in time in the future. You can't have 38 million people filing for jobless claims and not expect to have some kickback on that. When will it come? I don't know. But if you look at, we're going to have quarterly reports that are going to be coming out soon. Well, think about what April looked like in 2020. You've got clothing stores down 80%, electronics 60%, grocery stores, gasoline, everything is down because we've been told, stay home. Don't go anywhere. Don't do anything. You need to stay home. So it's likely that your lifestyle and your legacy goals haven't changed. But if you start switching around the way that you're doing your investing, it's kind of like you've got one flat tire and that we have the coronavirus. That doesn't mean you go around and flatten all the other tires on your Jeep. Now, keep in mind, we've got a coronavirus, a mind-boggling 30 million people, unemployment. Not only that, but we have approved $2 trillion in coronavirus relief package, then another $3 trillion. We're up to $5 trillion, and we've stolen $1 trillion a month out of our GDP from our economy. So when you're thinking about this, you have to make sure that you understand that you have a long-term plan. There's going to be short-term fluctuations, but we're here like we've always been to guide you through the murky waters ahead. And we're going to continue to give you good, sound advice and perspective all the way through these things. Now, some things in life have changed. It's like a good neighbor, stay over there. That's beautiful. I love it. Wilson, the originator of social distancing. I love some. I'm sharing my favorites with you. Some new skills have been acquired during the quarantine. Now, that is one way to fill up a coffee cup. That's beautiful. You got to love that. Some of y'all went from do-it-yourself, homemade, natural, all organic cleaning products to Clorox real fast. I just don't understand why I'm not losing weight. This Twinkie is so good. Day 2 without sports. Found a young lady sitting on my couch yesterday. Apparently, she's my wife. She seems nice. Before the quarantine. Oh, yeah. After the quarantine. Some things have changed. This is Danica going to pick up her stuff from school. This is Cooper studying. A lot more time with the dog. Some things will never change. I love this. This is the kids. They found the creek. They found a mud hole. Some things never change. Mushrooms still came up in the spring. You should not be concerned because we have you prepared. Preparation is the key for these things. So maintain an attitude of gratitude. I love this saying. Is when I was a boy, I would see scary things in the news. My mother would say to me, look for the helpers. You will always find people who are helping. So take a moment and say thank you to all the people on the front lines. We've got a lot of clients who are doctors. We've got a lot of nurses, healthcare professionals. We work with a lot of business owners, people that are out there doing their part. So we are here like we have always been to give you a level-headed perspective and lead you through the murky waters ahead. So Kevin Harrington, one of my favorite people, one of the original sharks from Shark Tank. I'm co-authoring a book. I just wrote a chapter on taxes. We're hoping that book will come out. He's got 5 Amazon bestsellers. One of the things that he talked about is anytime there is a pullback or things like this is dramatically affecting his business because he's in product sales. And he said, these are great opportunities to be innovative. And I often will think to myself, what actions would my future self want me to take today? So this was something I had talked about with him on a mastermind call here a couple of weeks ago. I've shared this with you. Danielle has started playing the guitar. She's doing guitar lessons. Cooper, Danica, and I are doing piano lessons. I think about what would I want what would my future self have wanted me to do? And I think my future self would have wanted me to be in constant contact with my clients, doing webinars. I'm very proud that we have done these things, and I'm very thankful to the clients that we have. So I want to tell you that we appreciate you. We appreciate the great feedback and comments that we've got in regards to all of the information we've been putting out and sharing. If you have questions, obviously you can call, email us. A couple of updates on the office. We are now going to be opening the office back up starting on June 1st, next week. We're going to have the office will be fully open. We did bring the entire team back in to work this week. So the team's up and running. We're being very careful in regards to wiping things down and all that kind of good stuff that goes with it. One of the things that I think about a lot is that there were a lot of projections that were made about what was going to happen. We've come to find out after the fact that a lot of the projections were wrong. They were telling us that their assumptions were wrong. Well, our projections were wrong because our assumptions were wrong, but we still can't go outside and we still can't go anywhere because the people who had the wrong assumptions and the wrong projections say so. It's just kind of interesting to me. I'm not being political one way or the other on this. I think every politician is going to try to take advantage of the situation. I fear that when we start giving up liberties for fear, that's going to get us into trouble. I think it was Benjamin Franklin that said that originally, some version of that. So one of the things that I want us to focus on is maintaining an attitude of gratitude. We have an attitude of gratitude. We're controlling the things that we have in our power to control. We're controlling our own attitudes. So I choose every day to have a good attitude. It's the only thing that I truly am 110% completely in control of. That's my own attitude. So choose to have a good attitude. Choose to surround yourself with people who have a good attitude. Choose to focus on the things you can control and not the things that you can't control, and choose to be happy. With that, I want to remind you all to stay positive, stay healthy, stay safe. We will be open next week. You can come in and do in-person appointments. We will wear a mask if you want us to. If you don't want to, that's fine. If you want to do phone appointments or Zoom appointments, obviously we have got the Zoom thing figured out, and we've run a lot of appointments over the past couple months right here using Zoom. So we're able to share screens with you. We're able to share screens with others. We've had a lot of people that have called and thanked us that are not currently clients. We've had some people that have called and asked us if we would take a look at what they've got going on. We appreciate all of that. Starting back in June, we are going to open up to accepting referrals coming in again. So if you know somebody that maybe isn't getting the level of service that they deserve, or they have questions, feel free to have them reach out to our office. We're actually going to be putting together some additional information. We've got a special report that we did. You can find it on our website, which are the 6 pitfalls, 6 of the 12. I've got 12 in my book, Retire Abundantly, but we've got 6 of the obstacles or pitfalls to retirement special report. You can go right to our website, request a copy of that. We'll get that out to you, and that can help with retirement planning as well. So with that, I want to tell you all that we appreciate you. Stay safe, enjoy the beautiful weather and the blessings that we have. And with that, we will see you soon. Take care.